yeah, it's still long way to controlling the marketing, yeah. Because the result is very interesting. Mbak Dian, can you tell us more about what is the action plan from our government? Because the result is very interesting, and I think because yeah, it affecting many things, so we need some realistic or some action. The second is for Mbak Ari, ya. Yeah, Mbak Ariana. Yeah, it is also the interesting study in with Java and also in Banten, ya, Mbak. Uh, uh, a lot of like the behavior change already done, and how actually, Mbak, can you elaborate more how to control like the what is that, the compliance? So how the because the Wi-Fi is the coordination between the health and education, right? And yeah, from our experience in some places, even like for the deworming, it is quite challenging also to when children take the tablet to, especially when they bring it house, it is so difficult to monitor. So, in your experience, how to control that, or how to ensure the reporting about the compliance, or is it only the distribution? The third question is to Mbak Evi. Yeah, because this is like the what is that, the rotation issue is always happen everywhere, ya, Mbak. So can you elaborate more, Mbak, about the involvement of the district education office, how to or other action to minimize that rotation issue? Thank you.
So if I should make a summary of the questions, the first question will be about the software to analyze the data addressed to the 3 presenters, and the second question will be to FP about how the monitoring effort have been done for NGTS, what are the challenges found in the field, and the last participant to us is Rufina. To the 3 speakers, the first will be to Mbak Dian. Given the interesting findings of the art study, what is the action plan, the aksi nyata from either from the HKI in collaboration with the government towards the findings, and to Mbak Nana, whether or not the effort that has been done also includes the compliance and how it was done, given that this program needs a huge coordination between health and education sectors. The last one to Effie, in one of the challenges that you raised is the rotation issue that may cause certain challenges toward the implementation of NGTS. Is there something that we can do to answer this issue? So maybe I will give to Marian first.
Thank you. Hello, Eka. We need to catch up for the software. So I should just answer all the questions to me, or only on all of them. So for the software, we didn't use any sophisticated software specifically for qualitative, just Excel. However, for data collection, we use the tablet using ODK Collect, and for the database we use ONA. This helps us enable to quickly collect the information and take photo using the tablet, and this is already included in the tools, so that when we upload the data collected from the stores or the point of sales, then this also includes the photos that already uploaded directly to the Dropbox. So Excel, human software, and human brain, so ODK Collect and ONA. For Rufina, for our action plan, thank you for asking that question. First of all, of course, reporting and disseminating the result. we have shared with our main counterpart at the national level, which is the Ministry of Health, and also the local authorities, Dinas Kesehatan, as well as the Bandung City government, not only the health sector, but also even the mayor and mayor's wife. And I'm happy to inform that HKI is now part initiative led by the First Lady of Bandung, because she has just launched an initiative called Bandung Saya, Bandung Sadayana Asi Exclusive, which one of the main aim is to strengthen breastfeeding support and monitoring system. We did identify that the underlying causes of these problems are mainly because of the regulation that needs strengthening. We have some regulations in place. The code have been adopted, but not as in total, so it is spread into two different peraturan pemerintah, government regulation, which is for the exclusive breastfeeding and also for the food label and advertisement, KP iklan label pangan. So this somehow only make the regulation in place, but not necessarily used. And we are hope to exercise the use of these, enhancing the monitoring system in Bandung to showcase how this regulation can indeed be used as a step or as a tool to monitor and strengthen the monitoring if there are violations found, and also help the communities to identify what are the causes of promotional activities that hinders the breastfeeding practice and the implementation of optimum infant and child feeding. The second is engaging more actors in the field to help us to work with of the Bandung City, mainly through the flag program by the First Lady of Bandung. We've engaged the PKK, which have a very wide network in the Bandung City, to be able to recognize such violation and then plan for actions that needs to be taken. The next will be, of course, the most important and the first point of potential promotion, which is the health sector, where infants are born and where breastfeeding hindrance is usually starting. So we also work closely with the Dinas Kesehatan to be able to strengthen the awareness, knowledge, and monitoring system.
Okay, thank you for the questions. Mbak Eka, untuk yang for the software used for this research, because the research was conducted not by I ourselves, it was conducted by Dr. Ina and team. So all of the arrangements of the research was with her team. We conduct, and I conducted monitoring and coordination and all, but we did not manage the data analysis, for example. But we received a report on the conduct of the research, and I can take a look and let you know on the answers for that. Hope that is okay. Thank you. And for Bu Rufina, thank you for the questions as well. You are absolutely correct that the monitoring of this project is quite a challenge, because it is a health program implemented not within the health sectors, So since this is implemented in schools, the health sectors needs to collaborate with the education sectors, not to mention with the religious affairs sectors, because some of the schools are religious-based schools for madrasah and etc. But to answer your question, so the guidance from the Ministry of Health for this project is that the tablet is given at school and to be consumed directly in schools together. So some schools gather the whole adolescent girls, the girl students in the school field, for example, and then they are given the tablets and ask them to consume the tablet in the school field. And some schools manage to give the tablets in each classrooms, monitored by the classroom teachers, and some also have their peer leaders helping the teachers to distribute and ensuring the tablets will be consumed. So actually by the guidelines itself, it's to be distributed and consumed in schools. So they are also requested to report not only the distribution of the tablets, but also the consumption rate of the tablets. We might think that, okay, once they're given the tablets and having their teachers in the classroom making them, okay, they will take the tablets, but not always the case. So we have received different percentage between the girls who are receiving the tablets and those who consume the tablet. This is a challenge too to be addressed by programs, how we should through various ways. One of it, for example, how we raise awareness among the girls, making them aware and adhere to the program. That's one thing. Also, through the provision pillars, we conducted like the project activities. We ensure we involve multi-sectors as well, not only the health sector. So, for example, from the when we conducted advocacy meetings, we are not only inviting the health sectors, the puskesmas, the dinas kesehatan, but also we invited dinas pendidikan, dinas agama. So from the education sectors, religious affairs sectors, and the local government, because the UKS in the subnational is with under the district secretariat. So we involve the multi-sectors into project activities, including the training. They are trained in certain way so that they have, at least they have the same understanding, the importance of the project. So they are able to support the program implementation in the field. For example, when the education sector, the dinas pendidikan, when they have their own meetings or they have a coordination meetings, they will also ensure, they will also asking about the WIFA program in the schools, for example. That's some of the examples how this project is monitoring compliance as well. Hope that answers.
So for the first question from Zakia about the software that used in the analysis phase. Actually our analysis is not done yet. So for this first phase, we still we don't use any software. So the researchers make a direct review and also coding and so on and so forth in the process of the analysis, and we make a comparative analysis with the Excel. So based on the coding or the theme that we already have, we take the summary and we see what is the difference between the intervention and the control group. Then we can have the lyric summary from each stem that we have. Of itself. Okay, and from Mbak Dina, thank you for your interest in the GTS program. Indeed, this is an interesting program actually. So your question are to what extent for the monitoring is done and also the challenges and strategy. So actually we deal with the monitoring phase because we would like to know what happened in the time of the intervention, in the time of their implementation progress. Yeah, so we would like to know their progress, their process throughout the time for about 6 to 9 months. So that's why we have the monitoring phase. And then at that time, since this is action research, we just act based on the school's needs. So we provide the consultancy, the expert to schools. We give them the not only asking what happened and what is the progress, what is the challenges, but we also help them how to improve their performance in the school in terms of implementing the program. So we have 8 schools, we have 8 progress, we have many challenges here. So for example, in one schools, they deal with the healthy school canteen. The schools already realize that they need a better quality of school canteen. They would like to build a new canteen, for example. So we, with our partners there, to help them in terms of our expertise, for example, related with the food safety, usually for the healthy school canteen, we give them the information how to build a healthy school canteen. While other schools dealing with the rotations of the school principals, dealing with the school garden and also the nutrition education. So they have a good progress. They make a good communication with the research team, yeah, during the intervention phase. So in the monitoring phase, we not only see their progress but give the feedback. So that in this action research, we can see their progress based on their capacity, the capacity of the schools. Yeah. And so the challenge in the implementations from each school that generally found are the perceptions of other teachers. Yeah, because the teachers who receive the training, only 5 teachers, so they have a challenge how to inform about the NTTS program, how to deliver the nutrition education to other teachers. Sometimes in one school, the environment is very good, so almost all teachers receive this information, this program, and then the teacher support, the school supports. But in other schools, they feel like they are an alien because all the teachers do not want to know about the program. That is the challenge that communicated to us, and we try to overcome together how to deal with these challenges. And then okay, Mbak Rufina, about the rotation issue. Yes, Mbak Rufina, dealing with the public schools is dealing with the government. And this NGTS program actually implemented in all school levels, from primary, secondary to higher schools, while the schools in the primary and secondary are under the district's government, and the senior high schools under the provincial government. So when we have these three level of schools, we have to deal with two local government in a different level. So we have to deal with district level if we deal with the SD and SMP, primary and secondary. And with this high school, we have to deal with the provincial level. So in this case, yes, one of our strengths is having an MOU with the local government. In Malang, we don't have any MOU yet, but we have experience in other districts where the program is implemented to primary and secondary. We have the MOU with the head of district level to Pak Bupati, and it is easier for us. It doesn't mean that there are no rotation between the school models, but the principals have exposure related with the program through the district education district level. So it helps us very much about that. So actually we have to, this is our challenge, especially from partnership in implementing the program, deal with the provincial level for the senior high school level. Okay, thank you. So thank you very much. That's for the first round. So I open the second round. I saw already two previously. Should I invite a male participants? Do you have questions? No? You? Okay. From the previous, I saw already two. The Mbak, next to Mbak Zakia. And then the other Mbak sebelah sini tadi. Oh yeah, the Mbak with the pink flower hijab at the back. And then Mbak sitting in the second row, the left side. So still waiting for the question from the male participant at this one. Thank you. So we start with the Mbak next to Zakia, Pak Ibu Zakia, Mbak Zakia.
Assalamualaikum warahmatullahi wabarakatuh. My name is Eka. I'm from Center of Health and Data and Information Ministry of Health. My question is for Dr. Dian. In Indonesia, as I know, there are only regulation for breast milk substitution for baby under 6 months to support as exclusive program. In your opinion, how about formula milk, complementary food and snack for a child 6 months and older? Is it not good to become consumed for them? Even the product has already followed the Codex rule in their composition and production. And the second question is, should Indonesia also have regulation about that, about food for child 6 months and older? Thank you.
So thank you for Mbak Eka. The second question, Ninis, thank you.
Hello, my name is Rebecca Sibia. I'm from Center for Study Indonesian Food Anthropology. So I want to ask with Ms. Effie, Ibu Effie. So how about the sustainability about your program, and then how to maintain in-depth interviews script or manuscript, because you didn't use software. As I know about from Max QDA software, it's really hard to maintain and to elaborate about the interview because there are many plots and many dots to develop about the interview script. So how about how you maintain it as a manually? Thank you.
I'm sorry, say again your name.
Repa, R-E-P.
Repa.
Yeah.
Okay, thank you. The last question.
Izin menggunakan bahasa, but it's okay if the speaker will answer in English.
Perkenalkan, nama saya Ida Fauzia dari Java Foundation. Saya ingin bertanya ke dua pembicara, yang pertama Mbak Asri dan Mbak Evi. Yang ingin saya tanyakan adalah, karena hal ini berkaitan dengan qualitative research, apakah qualitative research ini digunakan juga oleh ibu-ibu di depan untuk membuat atau memasukkan asumsi dan risiko dari sebuah perencanaan program? Jika iya, toolsnya seperti apa dan hal-hal penting apa yang menjadi hal penting dalam qualitative research untuk menentukan risk dan assumption dalam sebuah program? Itu yang pertama. Yang kedua, sekilas dari beberapa pemaparan ibu sekalian, qualitative research ini digunakan pada level baseline, implementation, dan endline. Yang ingin saya tanyakan, berhubung program dari kedua, dari NGTS maupun dari NI adalah program yang sifatnya tidak hanya 1 tahun tapi bertahap, saya ingin menanyakan apakah qualitative research ini digunakan pada level mengukur outcome? Karena biasanya kualitatif tadi kan dari frameworknya semuanya sifatnya kuantitatif. Apakah untuk memvalidasi pencapaian outcome tersebut, ibu-ibu menggunakan qualitative research? Jika iya, seperti apa metode atau teknis dari penggunaan qualitative research tersebut? Terima kasih.
So for the second round, we have 3 participants addressing their questions. The first question from Mbak Eka, Ministry of Health, to Mbak Dian. So her understanding, actually the regulations only for the products for the under 6 months old baby to optimize the exclusive breastfeeding. So whether or not we should pay attention also to the above 6 months products, commercial products of complementary food. And then the second question from Mbak Repa, the questions is about the the sustainability of the NGTS, and then how to maintain the transcription gain from many interviews that you have, given that you do not use any software. And then the last question from Mbak Ida to Mbak Nana and Effie, whether or not you use qualitative approach to identify assumptions and risks when you are planning your program, and then whether or not the qualitative research is used to complement, to assess the outcome, to like complement or validate the findings resulted from the quantitative approach.
Thank you, Mbak Eka, for your question. Yes, the regulation, we have PT 33 for exclusive breastfeeding. And since the code covers beyond infant feeding, infant age or infant formula, which is until 2 years or above, so we have another regulation that also adopts or can be considered as part of the adoption of the code, which is currently PP 69 tahun 99 di Kementerian Pangan. I think everyone in the health sector is waiting for the amendment. Hopefully it will happen soon. So for whether formula and snacks, although following the codex is considered safe or not for young children, what is the current health problem faced in Indonesia that not only health sector recognize currently? Can you tell me? Stunting, yeah. Even the president has declared or demand a huge decrease in stunting rate by the end of his term. So, and although stunting emphasizes the prevalence on young children, this is also a maybe this of a longer term problem, health problem, which is the increase of NCD, penyakit tidak menular. So, with respect to the increased stunting and NCD, when we started this project, we tried to look at the stunting rate in Bandung. 1 in every 4 children, or 25%, was the stunting rate in Bandung. But if you look at the number, 5,000 children is impacted, and this is even much bigger than other provinces with the much higher stunting rate in proportion, but like NTT or Papua. But given the number of population in Bandung, this means a very significant number of young children affected. So, looking at the composition of snacks produced for general population, what are the main contents of those? Yes, they are nutrient dense. Yes, they may be fortified, but they also consume, or we all very well know that most snacks consume high level of sugar and salt, as well as fat, DGL. And because these are produced for general consumption, so there is, when it's consumed by young children, there has not been determined whether the amount consumed by these children meets the dose that is safe for them without hampering their nutrition condition. And when it's consumed multiple times a day, almost every day, we know exactly this caused a displacement in their daily diets, hence the stunting. So we do really need some sort of regulation to strengthen the consumption, or at least to monitor the promotion. When we talk about infant formula, even the WHO did not prohibit production of breast milk substitute. We still need, BMS is still needed in this world, but with the proper indication. The problem is because they are promoted, and by promoting, people think these became the norm or the better diet, and this then takes over what is actually more nutritious, more beneficial to the young children. So our aim is to have a better regulation and improve better awareness and knowledge from the community that what is the most essential diets for and needed for young children to help them thrive. Hopefully, people understand that. But when on daily basis, they are bombarded by promotions, advertisement, merchandises that somewhat prevent people from accessing or from making a good decision regarding them or their young children's healthy diet, and we need regulation. I hope this answers your question. Thank you.
Yeah, thank you for the questions. I have received a question from Badia from Jakarta. Yes, on the whether qualitative research was used also for assumption and risk determination in the program. Yeah. So I would say um, qualitative research is something that is very important. Like without qualitative research, basically program is blinded. Like we don't know the story of the field. We don't know the story of our target. So in the beginning of the program, for example, we had assumptions. For example, we assume that these girls will voluntarily take the tablets whenever they are given because the tablet is for free. They do not have to pay for the tablet. So we assume that they must like the tablet and they will take it voluntarily. And it's even in schools and they must consume it in school. So we might have assumption that it will be easily received. But through the qualitative research, we found that they have other concerns as well. Not only that it is free, but they have concerns about they don't perceive they are at risk of anemia. They thought that they are not as at risk. They thought that they are not sick, and so they think they don't need the tablet. So that really changed the program implementation. That the program will have to adjust. We have to also approach the girls, not only the teachers, not only the health staff, but the girls. They need understanding also for themselves. So these kind of insights can only be gained from qualitative research. And actually, it's not always, it has to be like a formal research, but through, for example, monitoring visits to the field, then the meeting with the girls, meeting with the stakeholders, we have insights. We meet them and we ask questions. What do you think about this? What do you think about that? Through that forums, we can also gain more stories, and program will be adjusted, will be improved based on these inputs. I hope that quite answers for now. And also for the outcome, I would say qualitative aspects is always it is same importance as quantitative survey. So not only that we need data, but we also need stories behind this data. Not only numbers, but we also want to hear the stories. So in terms of validating the results, yes, it is very valuable having the qualitative studies. And also in terms of outcome, we have to also note that outcomes is a more distant results from program. So more factors play role in the outcome achievement. So yeah, it's just something to note, but I would say qualitative research, as I say, tells story, so it is important and it is being used. Maybe we can discuss more if that is not enough answering your question. I think that is all my questions. Thank you.
Okay, I will answer first from Okay. Yes, I agree with Eliana. Yeah, how important the qualitative approach is, and also what need to emphasize in the qualitative approach and also other studies before we conduct it is defining the objectives. So for example, if we would like to have the study related with the assumption and risk using qualitatively, it is very possible for us to have the study. But in our study here, we don't have the, we didn't put the, we didn't put that as the objective, to have the risk and the assumptions. But we implement that in the monitoring phase. That's why we have the activity in the monitoring by having the discussion and also having the provide the consultancy with the schools to minimize the risk of unimplemented programs. It is one of the our activities related with the study, for the risk and sanctions. And for whether the qualitative also taken to validate the outcome. In addition to Mbak Nana's answer, in some areas the outcome need to be taken quantitatively, and the qualitative is taken to make us more understand what happened in the study. So that it doesn't mean that the qualitative is not important, but it is very important to explain to us the lesson learned, especially for that. For example, when in the intervention and control group, we expect to have the different significant outcome, but then in the result, it showed the same. From the quantitative study, we cannot have the explanation. We only have the explanation of this is not a significant difference. While we expected to have a significant difference, for example. From the qualitative phase, from the qualitative approach, we can have an understanding. By digging the information, what happened actually, whether this condition is bad, whether this result is bad. Sometimes with the different expected, when we have the answer from qualitative approach, it doesn't like that. So that we have the qualitative approach to see the deep, as Mbak Ariana said, what happened behind the scenes. For example, the students' knowledge from the control and intervention is the same. Why it is the same? What happened? With the qualitative approach, we can find out from the process why it is happened and one exactly actually in what part this is the same. Actually, then we can have this kind of explanation. For example, even though quantitatively it's the same, but we have additional information that provide the result, the intervention. In the intervention schools, the condition is better with the control groups. Okay. So, from Mbak Reva, so about the sustainability of NGTS. NGTS is the name of our program in senior form. So we have therefore in the sustainability phase, we would like this program to be running. We have 3 phases here as a program: initiation, implementation, and institutionalization. So besides we have a close contact with the schools, we have a partners. That's our key. With the adoption of our program, our partners can run in this program with the different name even. We don't need the name of NGTS if, for example, the Poltekkes of Tasikmalaya from Cirebon would like to have different name, but the same program. For us, that still or that called sustainability. How this program is adopted. That's why in the implementing program in Asia Locus, yeah, we have so many partners. Yeah, we expected this program to be adopted to their program, yeah, to our partners, so that we can say that this program is sustainable. Yeah. For example, in Klaten, our NTTS name is adopted by Health Qualitative of Jakarta with a different name. But basically, the framework, the approach is the same. Yeah. And they have they come with a different name, but we still happy. Yeah. Because they work together with us with the same objective. Yeah, about this program, how we can improve the health status, the knowledge, the nutrition, education in the schools. Okay, I think, I hope it meets your questions.
So thank you, Bu Evi. I should ask the committee, should we finish the time is up? Okay, yeah, okay. So the time is up, so thank you very much for the participations. I should not make any conclusion from the presentations, and then but I can highlight that how the qualitative research has gained high attention as the vital part of decision-making process for a better program planning and implementations. And then recently there is a publications that try to position the evidences coming from the qualitative study as a complement in complementing and optimizing the evidence coming from quantitative study, because qualitative can provide information beyond numbers and statistics. So finally, I should extend my thank gratitude to the three presenters for being here and sharing the experiences, and also for the participants who attend the seminar, for the questions, and also for the attention. It has been a pleasure being here with all of you, and see you and thank you. Oh yeah, as a promise, so I will give this to the committee for the 6 participants who address their concerns, their questions during the discussion.
Okay, thank you to Bu Ade and also our speakers. And to the next is, I would like to ask Bapak Agus to come forward to give the token of appreciation to our honorable speakers and also